The effect of COVID-19 on care homes in Britain has been devastating. These are places where the elderly and frail should hope to live out their lives in comfort and safety.
We're here, Dad.
And yet, at least a quarter of all COVID-19 deaths have taken place in the sector, which lies outside Britain's National Health Service. And while there are signs the worst of the crisis may have passed, experts warn against complacency.
We need to see really clear evidence that PPE is getting to care homes. We need to see comprehensive testing, and that needs to be on a rolling programme, and it needs to test both staff and also the residents of care homes. We also need the NHS to really upscale its support to care homes. At the start of this pandemic they withdrew, and now they need to be really there, shoulder to shoulder with the care sector.
Care home staff, many poorly paid and without medical training, feel particularly let down.
It's been many decades now that social care hasn't been receiving the respect and recognition for the amazing work that we do. And I think this crisis particularly shows how much social care is on the front line, working hand in hand with the NHS, and that social care deserves parity of esteem with the NHS.
As Britain prepares to take the first tentative steps back to work, the government is counting on a falling infection rate to ensure the lockdown is lifted further, gradually, sector by sector, breathing new life into the economy. But there is a weak link, and that is social care. In the community at large, the trends are encouraging. Infection and fatality numbers are falling steadily. But care homes are struggling to shake off what critics describe as early policy failings by the government.
I don't know what the motivation was behind the decision, but a decision was made, it seems to me, that community spread was going to be allowed to run fairly unhindered, and that care homes and the most vulnerable were not going to be protected.
COVID-19 is one such natural event. Another is the annual flu season in the autumn. The great fear in the sector is of a dual assault yet to come against society's most vulnerable people. The government has promised testing for all residents and staff by early June and training in infection control. The wider concern is that new outbreaks in Britain's care homes could push the infection rate up and plunge the country back into crisis. Jonah Hull, Al Jazeera, London.